the top of the Empire State Building.
Dr. Christine Blaine, how are you? It's so great to get to meet you.
Yeah, I'm doing great.
So I was really excited to chat with you because I don't know much about this world myself. So I feel like I just kind of get to use this as a learning experience. And I just want to know, like, can you just tell us the 101? What does a plastic surgeon do? We all have the TV shows in our brains, but like, what's the real life for people like me who have no education on it?
All right. So basically, it's interesting that you say, what does a plastic surgeon do? Because most people automatically think of the cosmetic aspect of things, the breast implants, the liposuction, which, yeah, that's a majority of what I do, but that's the path I chose. What happens is when you're in med school, you have to make a decision on what you want to do with your life, and then you have to apply for residencies. And if you want to do plastics, there's multiple paths that you can do, but the most direct one is get a plastic surgery residency right out of med school. And that's one of the highest level of competitions there are, because like when I graduated, there's 81 spots in the country for that.
Gosh, that's so
position. And by some miracle of God, I got one of them. And so I did everything straight through. I did general surgery and plastics all at one place, a level 1 trauma center, and it was phenomenal. And then you have to take your boards. So the American Society of Plastic Surgeons, or the American Board of Plastic Surgery has like a crazy board thing that we have to do written, which is fine. Not everybody has to do written. Then we have to do an oral boards. We have to go out to Arizona, spend a weekend in Arizona, bring books with us that we had to create of our patients. Like we had to pick five cases for you. And then there's like other ones that are just randoms. And you sit in like your nice dark suit, whether it's navy blue or black, whatever, in the beat down sun in Arizona, outside the door, waiting to get into this hotel room. And then they start to, ask questions. It's very stressful, but it's rigorous. And it's the board certification. I think the biggest thing that people need to realize that there are a lot of people out there saying they're cosmetic surgeons, but they're not plastic surgeons. Plastic surgeons have to go through this rigorous training, and you have to be board certified by the American Board of Plastic Surgery. People say, yeah, I'm board certified. But if you ask them in what, they might say, oh, general practice. And they took a weekend course in cosmetic stuff, so it's a little scary sometimes. And everything's okay until it's not, right? Because that's what happens. We get all the complications from the people that don't go through the training. But, that's more of an education piece for people to research who you're going to see and make sure they're a board certified plastic surgeon by the American Board of Plastic Surgery, not a cosmetic surgeon, because there really is no board for that. It's weekend courses here and there and some, so it's very different. And with our training, we do everything from, cancer resections, from just skin cancers when we have to do little flaps on the face, to big cases where we might take a muscle flap and put it up in the neck for a head and neck cancer, to, somebody that's paralyzed and has a wound on their butt and we have to do a flap to close that, to, breast reconstruction from breast cancer, to breast augmentation, liposuction, mommy makeovers, and all the fun stuff too. And then we get trained in all the injectables, Botox, we all call it the gateway drug. Everybody that wants to start out starts with Botox and then keeps working their way through the system to get to some fillers and other non-invasive procedures. But it's a very fun field. We treat every age from head to toe, and it's pretty cool. The other thing we do is most of us still take call. So I'm on call for hospitals certain days of the month, so that if there's like a kid who gets injured and the mom wants them to be sewn up by a plastic surgeon, I'll go in and sew them up, trying to reduce the scar and, just the best outcome they can. So that's another aspect of my practice that I still really enjoy doing. And it's a good way to meet people in your community too,
So you do like the things that most people will stereotypically think of, but you also do those things. I mean, that's the only way I have knowledge of a connection. My mom, who is still with us, had a mastectomy because when I was about 13, she was fighting breast cancer. So for years, most of my recollection of it was working with you and people in your field afterwards, because she would always say, she's like, I want twins, like they have to, I want them to match. So it was just kind of this helpful, confidence boosting, experience for my mother. And then funny, like you're saying, little boops on the head. My sister had a weight fall right next to her nose. And to this day, my dad was like, we should have gone to a plastic surgeon. We should
Yeah.
have gone to a plastic surgeon because she's got a beautiful face with a little welt right next to her nose forever
Yeah.
for that. So it really is, in a weird way, it's kind of good to preemptively know the people that are with your degree and around you, just in case this isn't just about, hey, when I want to blank, I'll find out. You might be dealing with an unpleasant situation where you want to know you can go get that scar that my sister had essentially taken care of early and prevent that. Wow.
Exactly. Yeah.
Okay, so what would you say is your most common couple of procedures you do? And then do you have one that is either, I'm not going to use the word like fun, but just the creativity that you've had involved in it, you know, something really interesting that stands out?
Yes. So I think the most common surgery that I do still is breast augmentation and breast reduction. So it's funny, some I'm taking away and some I'm adding. So it just depends on what somebody's needs are,
Right.
not to the same person. But what the most challenging or fun cases for me are some of the reconstructive case of somebody who might have been born with an asymmetry, meaning
Okay.
somebody has an A cup on one side and a D cup on the other, and now they want them to be the same. So you're really doing two different types of surgeries there. Sometimes you're reducing and you're adding, you know, so you do have to have that little nuance. And it is a little bit of creativity too, because not everybody's birth asymmetries are the same either. So, and some people want the bigger side, some people want the smaller side, some people want something in the middle. So it's very different for each person, but that's a very rewarding case because it really changes somebody's outlook on life and just their day-to-day living. I've had young girls coming in and saying, oh, it takes me, you know, an hour in the morning to get the sizing right on each side, and I could never wear a bathing suit. I couldn't do sleepovers, you know, because people would either not know or they would make fun of them. You know, I'd had somebody was saying, oh, big one, little one, big one, little one. And at this point, I didn't have kids, and I said, if I were your mom and I heard somebody say this, it might not be a good situation.
Right?
You know?
Oh my God, my greatest fear is raising a bully.
Yeah. So, I meant like what I would do to the kid for saying
Right,
that.
no, I get it. My kid included, if I heard that.
Yeah. So, but luckily, like she had surgery and she was just a different person. Like her confidence was just, you know, through the roof. And it made me feel so good to see that I changed her life, you know?
Yeah.
Even for breast reductions, it's the same kind of thing. These women have such, you know, back and neck issues. And when you do the surgery that night, their symptoms are gone, you know?
Oh, goodness.
So it's amazing. And the best part about my job is you create confidence in people that didn't have it before. Sometimes, you know, and sometimes it's just the added level, or it makes people feel comfortable in their own bodies. And I think that's what I love the most, you know?
Yeah. I actually had a really interesting, like, I don't know what phrase to use, like coming to terms with full realization when I used to take all these media criticism courses in college, because on one hand, I felt like I was being taught any insecurities you have are all up here and from the media. And so overcome them. And then I grew up like very shortly after to realize, no, it's good to realize why things are where they are. That doesn't mean you're paralyzed to not do something about it.
Yeah,
Like
exactly.
these two can completely exist in harmony. So I just think it's really wonderful to understand it's not just what you're saying, a physical like ta-da, everything matches. It's how you start your day off when you get ready in the morning. I just don't want to hear the nuances of, like you said, big one, little one. I'm tired of dealing with people's crap on me. You know, it really can kind of fix, adjust, improve on a lot of things going on around you. I love that. So continuing on implants or augmentation, is there an app? Let's say someone is considering in the near future one of those two procedures. Is there an average amount of time you tell people to be aware to like rest and reset before you get back to work? Like what does that look like most of the time?
This is great. This is a great question. Recovery is always something that people want to know. And each surgery does have a different type of recovery. In the age of people working from home, it's great. I tell people, if you work from home, just think 48 hours to let all the anesthesia get out of your body so your mind is clear. So don't answer emails, don't do texts because you won't remember, but you'll be able to sit at your computer probably within 2 days and
Wow.
proceed with work. If you don't have that option and you're someone like me that has to go into an office, it will depend on what you have. Typically, a breast surgery is usually about a week that you need off, and tummy tucks are usually a little bit more because we do tighten the muscle in the abdomen. And
Okay,
it's
that
like
makes
you
sense.
do, I think you work out, right? You work
Yeah,
out?
well, not as much as I should anymore, but yes.
Everybody, right? But like when you do like a crazy ab workout and then the next day you try and get out of bed and you're just like, oh, and you can't get out of bed. That's what people feel like when we tighten the muscles in a tummy tuck. So I tell people, if you work out, you're used to that and you know how to overcome that. And most of those people tend to recover quicker. But if you're somebody that hasn't had the experience with working out and knowing muscle soreness, it might take you a little bit longer.
Right.
But overall, I usually tell them for the most rigorous jobs, usually 2 weeks for an abdominoplasty or tummy tuck. So most of the people can return to work within 2 weeks, and most of it's shorter. Breast augmentations, I mean, it's usually 3 to 5 days. You know,
Wow.
yeah,
that
even
is
if you're going to work.
Even
Yeah.
in my mind, it's like, my memory of like a later teenager. I remember my mom, I'm like, she got another, what?
Mhm.
Everything's fine now?
Yeah. Yeah.
How she'd be in and out. So when you really are dealing, especially with someone who knows what they're doing and how to do it, it seems like it had like minimal
Yeah,
impact.
and we ensure that they know what their limitations are. So yeah, you can go back to work, but if you're, say you're a checkout person or a stock person at Costco, you're not going to be able to lift that 10-pound thing of water, so you will have some limitations, but that also will depend on what the surgery was. So
Right. Okay. Well, let's move north and say a lot of us wear our stress, our fatigue, our life on our face. Whenever someone comes in and they're like, listen, I just need to seem a little more caffeinated all the time. Is there like, what are the different options you walk people through?
So this is very, very hot topic with Zoom meetings, right? So, people all say, oh, I look at my face in the screen all day long. It's driving me crazy. The lines here, this, that. So I start out with having them meet with my esthetician, because not all surgery, there's things you could do. I tell people, your skin is your largest organ in your body. You have to maintain, you have to give it some love. Giving it some love might be something as simple as a medical peel, a facial, things that aren't surgical, but you should be doing these on a routine basis. Something that I love that my esthetician does is something called dermaplaning. She takes a scalpel and scrapes off all the dead skin and
I've
the
seen that
little
on Instagram. Is that?
Oh, I
Okay.
love it. Love, love, love it. And then she'll do a peel on top of it. So now your dead layer of skin is already gone. So the peel can penetrate a little bit better and you get a better result. But it's wonderful because these are the things you should be doing monthly, every other month. And people forget about your skin. You go get your nails done, you get your hair done, but you forget about your skin.
Yeah.
But by far the most important thing you could do is protect yourself from the sun. That's like number one. Sunscreen every day.
Yes.
Every day. Winter, summer, doesn't matter.
I've even heard you're even working inside because UV rays come through the window. If you have a beautiful open light, place, you should still be applying.
Yeah, so there's plenty of products out there. I tend to love Elta MD. It's a dermatology and plastic surgery line. It's very lightweight. They have it tinted. It's great. I use it every day on my face. We also have it's called Skin Better line that they also have it. It's a little bit more of like a foundation type where I don't use foundation. I'm very basic. So probably too basic, but it's a little bit more of a foundation. So you don't need foundation. This is your sunscreen foundation. It's great. People love it. It comes even in a little powder pack where you could put it on like powder, and it also comes in a pump. But those are really the first and foremost. Then you start to move into, there's other treatments for your face that you could do. Microneedling with radio frequency. Radio frequency is the hot thing now. It's one of the best things for skin tightening. So again, you don't want to wait until you need surgery to facelift. You want to do things when you're and it's great because more people are in their 20s and their 30s starting this preventative regimens. So a lot of people do Botox, and Botox is just the name brand. It was the original one that came out, but it's botulinum toxin, and now there's 4 different types, which all have their little nuances. All are great. Xeomin, Jeuveau, Dysport, and Botox. So those are the 4. Some people like to stick to one that they've tried before. So I carry them all and kind of use what's appropriate for a person. But those are for the lines, like especially here, here, and here, I'm talking, forehead and
Mhm.
crow's feet. And now the newest thing is what's called a lip flip. So
A
you do a
lip
little bit of lip flip. So you do a little bit of toxin here and it kind of lifts up your lip just a tiny bit to show your lip a little bit more. And you don't need, so if you're afraid to get a filler, because a filler is
Right,
like the
right,
next
right.
level. So, or for someone like your age that you might not need a filler yet, but you're like, you know what, I want when I put my lip gloss on or something, just to be a little bit fuller.
Little pop.
And this is perfect. Yep. So
Oh my
this is
God,
this is a great treatment. Lasts about 3 months and it's great.
I love
So-
that. My joke for myself is I'm saving, like I'm gonna get veneers when I'm about like 55, because that's when like my mom and my aunts, like their lips started to go down. I'm like, because it's essentially it gives like a little lip flip. I didn't even know about that. Maybe I'll add that to the list.
But you brought up a wonderful point though, that a lot of people think that it's the skin that starts to hang, but it's really the bony structure that starts to erode. So
Yeah.
when you're doing these procedures with fillers, it's very important for someone to know technique to put it in the right place,
Right.
because and a filler, it's a syringe, it's 1 cc. That's not a lot, like it's 1 milliliter, really not a lot at all. And people think, oh, I can't do like more than one syringe, but you realize like it's not a lot. So
Yeah.
you're asking a lot from one syringe. So you really have to make sure someone can place it appropriately and utilize a little for more, or have someone explain to you that, 2 syringes isn't a lot, 3 syringes isn't a lot. I think it's a
Right.
fear that people have too.
Right, right,
So-
right. You have to go to the right person. I mean, do the people that you were mentioning earlier with the not degree also have the ability to do these same things? Is it
So
possible?
actually, yeah, so
Okay.
there's a lot of people who are allowed to do Botox and fillers, nurses, PAs, nurse practitioners, and any doctor, which
Mhm.
is fine. Like there's a lot of training out there, and I'm not saying that nobody should do this by far. I think that there are a lot of people that can do it and are very competent at it. It's just more of the the surgical procedures that we trained for many years, and it's just more of a safety issue.
Right.
But for toxin and fillers, there are plenty of very competent people out there that aren't plastic surgeons, but a lot of people feel comfortable coming to a plastic surgeon because we know the anatomy, we know the dissected planes, so
Right.
it's a
It's
personal
kind of a
preference.
why not situation at that point.
Yeah, well, sometimes it's more expensive, so that takes people a different route for that reason.
Yeah,
So
that makes sense. So, I mean, on that note, do you accept insurance? Like, how does that work for?
So most plastic surgeons are what's called out of network, and a majority of plastic surgery is not covered by insurance. But breast reductions are one of those that some insurance plans do cover. And if you have what's called out of network benefits, we can get it covered. So I do a lot of them through insurance. But even today, we had somebody come in and they have Cigna. Now, Cigna is a very big insurance company and has probably hundreds of different plans. And this person actually had a Cigna plan that it specifically states it is not a covered procedure under this plan. But meanwhile, last week, I performed surgery on somebody with Cigna who was covered. So it's very variable on the plans that people have too.
Gotcha.
So it's a little frustrating because this is something physiologic and it really, in my opinion, should be covered. So
Right, right, right. Yeah, I did have a friend in high school who had quite the battle getting it covered. At our age, she was like
Yeah.
18, 19, and it was without question a life-changing procedure.
Yes,
Her
yes,
insurance was like, it's not necessary because it's a breast augmentation. She's like, not
not
how it works. So,
no,
yes.
no.
Happy
And
to say she's very comfortable now.
yeah, and I mean, I fight for my patients, like as much as I possibly can. I'll get on the phone with the insurance company, things like that, because it's
Right.
really important. And I think like some people are afraid of it because there's been stories about as the surgery happens, like your nipple is taken and put somewhere else, and then they put it back on, and I don't do that. I haven't done that's called a free nipple graft. I haven't done that probably since my residency. And really now there's techniques that can be done to allow a very natural look and a long-term look. So it's good too.
Okay, fantastic. It sounds like it's come such a long way, even again from what I heard from a friend of mine in high school.
Mhm.
So I mean, along with that, what would you say some of the other common misconceptions you hear, especially by people walking in?
I think a lot of people don't understand the difference between liposuction, a mini tummy tuck, and a tummy tuck. Because a lot of people say, well, I don't really have that much skin. It's all loose up here. And it's okay, but in order for you to get this loose skin up here, you need to do a full tummy tuck. Like a mini tummy tuck is somebody who had a C-section and has just like a little blip over their C-section
Yeah.
scar, something along those lines. So that's sometimes tough because people come in with a preconceived notion that I only need a mini. And then you're like, oh, well, you really need a full tummy. And they're like, whoa, a full tummy tuck. You're like, whoa,
Right.
so that's sometimes tough. And the other thing, a lot of times people come in and want something done to their breasts and they really need a lift. They need incisions on their breasts that people are scared of. So you have to have an incision around the nipple and down the front of the breast in order to lift that tissue. Because if you put an implant in, the implant can sit up here, but all your breast tissue sits down here. That's not going to look good,
Right.
But sometimes they're like, why can't you just put an implant in,
Right.
well, you'll have bigger hanging breasts,
I don't think I'll fix your problem with that.
So
My father's a pulmonologist, and he jokes that the internet is the best and the worst thing that could possibly happen to people in the medical field.
Yes. So with the internet, I think the toughest part are these Facebook groups. Some of the things that they talk about are a little bit excessive, and it sometimes scares people.
Right.
Not everybody's experience is the same. And that's the tough part. And you're reading testimonies from somebody that had it done, but maybe they had other issues, or maybe they were a lot bigger than you, or maybe they were a lot smaller than you, and your recovery isn't going to be the same, and your surgeon isn't going to be the same, and their plan isn't going to be the same, and there are people giving advice.
So many elements.
People, and they're not medical,
Right. Yeah.
So,
and everyone's a freaking professional.
Yeah, it's a little scary, but it's nice for people to have that bond. So these groups are good, but it's almost like they should be overseen by a professional. But
right.
Sometimes I read them.
Right.
I want to comment, but I'm like, I'm not commenting because I'm not giving my medical profession out there,
Right. And honestly, the last thing I would expect is for someone really upset to be like, thank you for your input. That was a great point. Didn't realize. Have a great day.
Especially if they're not my patient, not my patient, I shouldn't be commenting. So
right. I think the best thing and one of the hardest things for most of us to deal with, and not just dealing with this profession, is you need to keep somewhat of an open mind in just knowing that if you go in expecting something, it's possible that your professional, tried and true, is going to say, I hear you and I see why, but that's not going to work for what we're working with right now. And just accept that that might also be part of the process, because that could be one of the reasons it didn't work out. For those people.
Yeah, definitely.
Very possible.
So the other thing about plastic surgery is that it's not always surgery. There's a lot of minimally invasive options out there now. So I think plastic surgery does still have that stigma attached to it. And some people want to talk about it. Some people don't want to talk about it. Some people say, oh, I'll never do that. But there's so much out there that can help without the surgery. We have different lasers and different machines now that can help tighten skin and reduce fat. And, there's cool sculpting is still out there despite some bad press recently. But it's still a great machine. It freezes fat. Then we have a machine that melts fat, so there's different modalities now that you could do.
It's like a Willy Wonka fat situation. Like, what do you want
to do with it? Let's go to the freezer or to the oven. But heat has been known to tighten skin and reduce fat. And there's a treatment called Transform that it helps to tighten the skin, reduce the fat, and build your muscle all in one treatment. So you do 4 treatments. Love and it's actually very comfortable. It's kind of cool. I have it set up where you come in, you can watch YouTube.
Yeah, I did Emsculpt Neo. That was
similar. Yep, similar idea. Yep.
Yeah, I thought it tickled. People warned me. They're like, this might hurt. I'm like,
no, it does. It tickles a little. Yeah. So exactly, it's the same kind of idea. It's radio frequency with some muscle stim, and So
I've got to bring my mother in, because she has, and I never I never want to devalue or poop, especially it's not a professional in anyone's fear, but she really doesn't want to do Botox, which is fine. She's like, I don't want to put anything in my face. I'm like, okay. There's a whole world out there though.
Yeah.
And we got to go look for it because no one's going to put a pamphlet in your mailbox.
Yeah,
So
very true.
maybe
Yep.
I'll ask her to watch this afterwards.
Yeah.
Well, I'll come see you soon with her. You're gonna love her.
Yeah.
What would you say is, I mean, I know you've touched on it, but like your most rewarding element of this job? I know it's got to be so broad. You've covered so many things, but just
Yeah,
what makes you
it's
smile?
honestly that discovery after surgery, when people look at themselves in the mirror and they're like, oh, and you see their faces, or the comments from like the breast reduction patients, like, I can wear a matching set of pajamas, and I'm like, what? And they're like, oh, I never could wear the top that matches the bottoms. I'm like, I never would have thought of that,
Right.
and just the surprise on their face, or their relief on their face when they see the results. That's really the coolest thing. And when they say like, wow, I'm wearing this dress I've never worn before, or there's even more in depth, like, now I'll let my husband see me again, that kind of stuff. That they feel,
I don't know how you don't cry all the
Yeah.
time.
Oh yeah, there's tears. There's definitely tears. And patients are like, can I hug you? And I'm like, okay, and it's like, it's cute. And it's hard because it's COVID and you're kind of like,
Yeah, right.
and yeah. So but it's cute. I mean, my staff is amazing. I think that's one of the things that set my office apart from other offices, is that people come in here and they feel comfortable. They don't feel threatened. They don't feel judged. We're a very cohesive group. Most of my staff has been with me for 3, 4, or 5 years, and we all know each other very well. And everybody wants the patient to be happy and have a good result, and everybody will check in. They'll pop in the room and be like, oh, Mrs. Jones is here, and oh, I want
Right.
to see her. And everybody comes in. It's like a party,
Yeah.
We have like post-reduction dance parties where the woman's like, I don't care if I have a top on, I'm dancing, it's like, it's so cute. You just see the joy, and it's great when my entire office shares it with the patient too,
It's
and
like all-encompassing warmth, it sounds like.
yeah. And, it's from the time somebody calls the office, like Rebecca at the front desk is just this voice of pleasantry and welcoming, and, and everybody, it's just from each step of the way. I hope that across the board, nobody ever feels pressured, because that's not why I'm here. I don't need to sell someone plastic surgery. If you're coming to me, you want something, and I'll guide you, but you have to be ready and you have to be comfortable.
That sounds so wonderful. And I think it's really great for people to hear not just, the mathematics, this is why people come and how people leave, but just like the humanity and the warmth. And it does sound like a really stressful situation, a lot of different ways people come in to see you. So to take that away in your office, and to the best of your guys' ability, just sounds like priceless, basically, to anyone who walks in. So that's wonderful.
And it also is very resounding that everybody here, especially me, like, we love what we do, like,
Yeah.
I love to operate. I love what I do. And I think it's very important, because sometimes that can get lost along the way as you age in your career. And I can't believe I've been doing this since residency 10 years already. I'm like, where did that go? It's like, how did 10 years pass? Like, I feel like I'm still just starting, and it's great. And I love it. And I love the field, how you constantly have new things coming out, new technologies, new procedures, new ways of doing things. And I love to learn. So it's a field where you're constantly learning, so it's just fun, and I love what I do. So
That sounds wonderful. It sounds like you found a career where not only are you passionate, but you are never bored and you're never not helping someone.
yeah.
That sounds pretty like goals, no matter what someone's interested in. That's wonderful. Oh, Dr. Christine Blaine, thank you so much for letting me come pick your brain, learn a little bit. I'm going to see you in person when I bring my mom.
Awesome. That'd be great. Get to meet all my awesome staff too. So
Wait.
From the top of the Empire State Building.
Z100.